So that takes us to a completely different part of the study process, which is the contracts and costings element. So we're going to hear from Helen Hodgson and Fiona Dunn now on what it's been like trying to contract and do costings in a national model.
Thanks, Nikki, and welcome everyone. We're today going to give you a whistle-top tour of costings and contracts in a national context and how it's evolving to make Wales and the UK more attractive to carry out research. And just to give you some introductions, I'm Helen Hodgson. I'm the Senior Research Funding Portfolio and Directorate Manager, and with me today, my colleague virtually, is Fiona Dunn, who's our Research Contracts Manager, and we're both from Health and Care Research Wales Support and Delivery Centre. So what we're going to cover in the workshop today, we're going to talk about the evolving world of costings and contracts and how it's going to help set studies up quicker in Wales. We're also going to go about show you how we went that one step further to ensure rapid setup of COVID vaccine studies in the middle of a pandemic, and how this approach could now be used for further studies in the future. We're going to give you an overview of the costings and contracts tools that are in place and or in development that underpin these processes to make life easier for us. And we're also going to touch on a new strategy and ways of working in the UK with a focus on costs and contracts. But before we go on, it'd be really interesting to hear from you as to what delays you have experienced with setting up studies, and we'll just give you a few moments to put some comments in the chat, and then Nikki will pick some of them up for us.
I'm waiting for the first one to appear.
Unless perhaps no one has any delays and we can go for a coffee break.
Nobody can think of any delays.
No.
I'm sure there are delays. There's a lot of people on this call, so I am sure that somebody has experienced some delay in getting a study up and running.
If not, we'll move on. And we can give you our experience and feedback from other places across the UK. So, kind of, as I said, there's one of the main delays in setting up studies has been linked to agreeing costs and contracts during the study setup process. And this flow diagram just gives you an idea as to what has been causing some of those delays. So from a commercial research point of view, as part of the approvals process, there used to be a very light touch review and validation of the old Excel industrial costing template. And there was no detailed contract review carried out, and this resulted in every site taking part in the study in the UK having to do their own individual cost and contract negotiation with the sponsor or the CRO. And as you can imagine, that is a huge duplication of effort. It causes delays, and also some sites were coming out with vast cost differences, which may have been rightly or wrongly, but as you can imagine, this caused huge frustrations for the sponsor or the CRO, and also the study teams who just wanted to get going and set their study up and start recruiting. So us in Wales, we really wanted to find a better way of doing this. How could we speed up study setup? How could we do cost and contracts reviews more efficiently? And I'm going to pass you on to Fiona now, who's going to give you some kind of idea of what we've been trying to put in place to improve this process so we can have a speedier study setup. Over to you, Fiona.
Thanks, Helen. So a couple of years ago, the representatives from the R&D offices met with myself and a couple of colleagues for Health and Care Research Wales, representing contracts, and we just around the table discussed all the contracts and what we found was acceptable and not acceptable in negotiating. And there was a series of workshops, and out of that we sort of determined that actually we were all on the same page, and what was unacceptable for one health board was the same for other health boards and myself at the support and delivery centre. And so from that we sort of produced a guidance which we went by, and then we all had a common goal that we wanted to have increased numbers of research sites in Wales, and not just sort of single site studies. And to allow that, we thought, well, if one person did give the costs and the contracts, and other health boards were able to accept that, then it would be a swifter way and a more streamlined approach of and increase the study setup. So it wouldn't be any delays with individuals negotiating their own contracts. So that's how the beginnings of one CC, one cost, one contract started, with a round table discussions with the R&D representatives on contracts. So the concept sort of then developed, so it made sense that there was a lead reviewer, and determining the lead reviewer, it was somebody that if there was a health board that had a CI that was at that health board for a study, a chief investigator, then they would be the lead reviewer. If there was a study whereby one health board started first before the others, then it made sense that they would go first and they would be the lead reviewer. If there wasn't an obvious lead reviewer, then it would be either myself and Helen or our colleagues at the Support and Delivery Centre that would act as the lead review. We also found the benefits of the commercial site agreements using the model agreement templates, and we all agreed that that was the way forward to use, and also implemented the use of standard costing methodology presented within the interactive costing tools. So whilst firstly, initially the contract discussions were taking place, and then afterwards further discussions were going on with the R&D offices with Helen, and with that was the forming of the one cost and one contract sort of beginnings. Next slide. Okay, so in a model template, this is how it looks. So a study, a lead reviewer was allocated. That lead reviewer would do the negotiations on behalf of the individual sites, and then that would be accepted from site B and site C or whatever, how many sites there was, and then the contracts will be signed and the costs would be agreed. It was sort of beneficial because for the sponsors' point of view, because then we were saying, look, we've already negotiated this once, or the other, if you want other health boards, they want to negotiate the same terms as what already been negotiated. So it saved duplication and sort of made it more streamlined and more effective. Okay, so moving on from the one cost, one contracts approach during the pandemic, during the vaccine trials that took place, we developed a UK approach, and a lot of people where there was one site for Wales and for one site, and then from the one site there was service providers from each site. So one site for Wales was Public Health Wales, so they were the ones that were contracting with the sponsor, and then there would be health boards that were providing service provisions on behalf of Public Health Wales in a subcontracting arrangement through an SLA. There was a development of a vaccine hub, and as I said, there was one site agreement rather than individual site agreements for each health boards involved in the vaccine trials, and there was one principal investigator. And as I said, the locations was delivered the studies through a pass-through arrangement via a service level agreement, and this was adapted throughout the UK, and other sort of NHS trusts throughout the UK also went with this approach. And the SLA template, the lead review was done by an author was Wales, and we developed that for the UK to use as well, which is used in this for this. Over to you, Helen.
Thanks, Fiona. So this just gives you more of a visual description of the regional vaccine delivery model, and it allowed Wales to go that one step further. It's not only just having a one cost, one contract, that's like what Fiona mentioned, it also had one site, which was Public Health Wales, and one PI. And this was hugely beneficial to the sponsor, because from a costings and contracts point of view, it allowed there to be one point of contact to carry out the costs and contract negotiation once. But it also fed into a UK-wide initiative for having a costings expert where the CI is based, to carry out the study level cost negotiation on behalf of all the sites involved in the study in the UK. And then when it was passed down to the site, all that needed to take place then was minimal local cost negotiation, which we did once for Wales. The contract between the sponsor and the one site, so Public Health Wales, was only negotiated once. And this was irrelevant of how many locations that may have come on board to deliver the study. And as Fiona mentioned, there was a pass-through service level agreement between the site and the locations. But this fed into a much bigger picture. As you can see in the blue circle there, it fed into the All Wales Delivery Support Service, which involved numerous elements and fantastic collaboration across the whole of the support and delivery infrastructure. And this enabled 3 vaccine studies to be set up really quickly. And these were in Cardiff, Bexley and Swansea, and potentially in another location in the future. But just as important, it also provided a platform or a pilot for potential future working by having one site and one contract for Wales with multiple locations for study delivery, and therefore making Wales a really attractive place to carry out research. And there was a number of massive achievements with this regional approach, in that, as mentioned before, there's one point of contact with the sponsor rather than dealing with numerous people on the same thing. And the feedback we received from sponsors was that they had confidence in the approach and found it hugely beneficial. And some sponsors gave feedback in that they would like to come back to Wales and use this approach. They just found it so streamlined and a kind of speedy setup. So we kind of need to take that on board, in that this is what the sponsors are looking for. And also it fed into a UK-wide way of working. It also increased collaborative working across the UK, and we fed into that with regards to the setup and the rapid delivery of the COVID vaccine studies. But from a costings and contracts point of view, we were able to carry out the negotiations and set up the first vaccine studies in less than 1 week, which I'm sure you all will agree that it was a huge achievement. But we also recognise that behind the scenes, it was a lot of work, and it really took us at times out of our comfort zone and working to very tight deadlines and having to turn things around really quickly. And we're fully aware that it's not a perfect model. There's further improvements to be done, and it's an evolving process. But what we were able to show through this process is that Wales has the ability to be seen as one slick front door. It's able, by using this approach, to be able to set things up much quicker and really put Wales on the map. We also found through this process that we were able to review and approve amendments much quicker. And as I said, it's really making Wales an attractive place to carry out research. Pass you on to Fiona now, who's going to talk about the tools that are in place to help underpin the processes.
Thanks, Helen. So have I jumped? Okay. So the current tools in contracts at the moment, there's a suite of model agreements that are live, which you can find from the IRIS help pages, but also you can find from our website, Health and Care Research Wales website, in the model agreements contract section. And so these are commercial and non-commercial agreements from primary care and PIC agreements. There's a whole suite, and slowly we're working our way through at the minute and getting in the 4 nations and getting them revised and updated. So that's the current suite, and then there's further work that's going to be developed and released this year, including standalone data protection agreements, ATEMPs, CTAs, and non-interventional commercial agreement, material transfer agreements. And there's a third-party provider agreement, which is basically the SLA which was developed in Wales for the vaccine trials, is going to become part of the suite of agreements modified so it can be used across for other studies as required in commercial and non-commercial pass-through from the site agreements. So there's lots of development going on for tools. And then in the costing section, there's the interactive costing tools for commercial research and the SOCAT for the validation of attribution for non-commercial research. Over to you, Helen.
Thanks, Fiona. Just to touch on some of the kind of UK-wide vision that Caris Thomas talked about in more detail earlier, but from a costings perspective, there's a programme of work called the Single Contract Value Review that is taking place, which will further help improve costing consistency and standardisation across the UK. It will allow a commercial sponsor to come to the UK and find out very quickly how much it would cost them to deliver their study in the UK or in particular sites, so there's no hidden surprises. And in turn, this will increase the speed of site selection and study setup in an efficient and streamlined way. And it also feeds into a nationally coordinated study setup service. And what we said throughout this presentation, with the ultimate aim of making Wales a more attractive place to carry out research, and also to be able to give patients more opportunity to take part in research. And just finally, thank you for listening to our presentation, and we'll be happy to answer any questions.
Yeah, thank you.
Thank you both, and and thank you not just for the presentation, but obviously you have been instrumental in supporting getting studies up and running quickly in Wales. So, you know I've said it before, but we'll say it in front of a lot of other people. One question just before we go to the break then that I'll pick out of the chat is that obviously the sponsor is part of that conversation and can often, as we know, one of the delays, and Lucy Jenkins has highlighted it, can be pretty unresponsive. So we're often waiting for the sponsor to reply. So how do you think this approach has supported managing the sponsor, managing upwards to the sponsor in a positive way?
Yeah, I think obviously we're in a different space in COVID, so probably the sponsors were more kind of responsive as they may have been in other situations. But I think the fact that they just have to deal with one person, it was definitely helping getting a quicker response. We were kind of turning around very, very quickly and getting responses from the sponsor within a matter of hours. I don't know whether you've got anything else to add from that, Fiona.
Yeah, in the very beginning, it was sort of, if you've got any queries to do with the costings, Helen, refer to Helen. Anything to do with the clauses in the contract, refer to Fiona. And they had the point of call, and when we sent emails to them, they were quite quick in responding. Actually, there doesn't seem to be a problem, but I think it may be because of the urgency of getting the studies up and running, and also because we said we could deliver to the timeline that they wanted, and because it was a fast timeline, they knew they had to reply quickly. So.
Yeah, thanks both. And a final question to pick up from Gemma Hughes around legal question, Fiona. What's Welsh Health Legal and Welsh Risk Pool's view of how they view the single site model? So do they look at it as one legal entity? How is that resolved?
Well, the Shared Services Department did review the SLA and they were favourable with it, so they are aware of it and they didn't have any negative comments to make about that. So, yeah,
we've been working closely with Welsh Health Legal. You do throughout the development of this, so you know, it's important that we stay connected and make sure that indemnity arrangements and accountabilities are really clear, and that's some of what you've been focusing on obviously in the vaccine. So thank you both very much indeed.